Welcome back, y'all. Kurt here with Dr. Jake, and today we're covering a topic I think a lot of folks are going to be interested in, and that is the assessment of metabolic health. Now, if I go back, all the way to high school biology, I remember my teacher throwing up a slide on the screen. It was on the good old overhead projector, and basically telling us, hey, here's your metabolism, here's what you need to know. But as I've gone through a little more life here, I think I realized that metabolism is not quite as simple as just one simple slide. So, Jake, can you tell us a little bit more about what metabolism is and just what components make up it?
Absolutely. So metabolism is a very broad and complex term. I'm surprised your high school biology teacher couldn't fit it all on one slide, but I'm going to attempt to do the same thing real quick here. So it's all of the chemical reactions occurring in your body, everything involved in converting food to energy and then using or storing that energy, building structural components, and recycling waste products.
Yeah, I think it's cool as you can break it down into those three categories. So we've got the fuel to energy, we've got the building of structural components, and then we do have that recycling waste to energy. And that's going to be a theme that we talk about a lot here as we go through things. Now, I think what a lot of people want to know is, all right, what can go wrong with my metabolism, and where's this dysfunction word start to creep in?
With such an intricate and complex system, obviously a lot can go wrong. There are a lot of genetic conditions that present with very severe dysfunction, such that these things present very early on in life. Those are important, but in our practice, what we're more looking for are metabolic dysfunctions that are brought on or exacerbated by lifestyle factors and then their long-term consequences. So these things are strongly interrelated and often co-occur. They're things like insulin resistance, high blood pressure, high triglycerides, abdominal obesity, to name a few. These things occur together so commonly that we've lumped them together and given them a name, the metabolic syndrome.
Yeah, that's a phrase that gets tossed around a lot here, but I think the big piece that you hit on is the fact that how interconnected these things are. That's a theme I see a lot. Now, let's just jump right in because, the first one that we get a lot of questions about is this topic of insulin resistance. And I know we did a previous video on this, but one thing that a lot of people are just looking at the surface level and saying, hey, I'm looking at A1C and saying, all right, yeah, that looks good. But tell us a little bit more about how you screen for insulin resistance and how that assessment might look.
Absolutely. So we're obviously starting with the standard test that you're probably familiar with from your primary care doctor. So your fasting blood glucose and your A1C. These tests are important to check, but unfortunately can miss early stages of insulin resistance. So we also include a couple of screening scores. One's called the HOMA-IR, and the other one we call the Insulin Resistance Index. These are just calculated scores based off of a few other biomarkers. And they're not diagnostic in and of themselves, but they can help us identify patients who might benefit from additional testing.
Yeah, to take that and segue, what types of things, if you get a score back that, may have a higher probability or higher likelihood of insulin resistance, what types of additional testing would people even look for?
Good question. So we've got a couple options. One of them is more on the laboratory side. One of them kind of gives us some more real-world data. So in the lab, we can do the oral glucose tolerance test. And this just is a test done over a few hours, shows us your body's response to a glucose load. It's diagnostic and gives us some really important information about your insulin sensitivity. Another really cool tool we have that does give us kind of more real-world data are these continuous glucose monitors, or CGMs. These are wearable devices that can continuously check your blood sugar levels and show you trends over 10 to 14 days and how your blood sugar responds to different activities, different foods, different eating patterns. And it's really useful, actionable data. It's a really cool tool. I'm really glad to be able to use those in our assessment.
Yeah, it seems like there's multiple layers that you can cover with these. Now let's move ahead to another category of assessing metabolic health, and we're starting to get into big words here. So hyperuricemia, did I get that right?
Yeah, you nailed it. A big word that just means high uric acid in the blood. So you've maybe heard of uric acid. You might associate it with a condition called gout. It's just a painful arthritis. You might also associate it with alcohol, especially beer, or a meat-heavy diet, especially processed meats. And these associations are all true, but I think more importantly, why I care about gout or care about uric acid and I'm checking uric acid levels is because it's a byproduct of metabolizing dietary sugar. So in the process of converting sugar to fuel, you get uric acid off to the side. And this is important because high uric acid levels are associated with high blood pressure and cardiovascular disease.
Interesting. So the assessment there is actually assessing for uric acid, but maybe looking at it in a bigger picture beyond just looking at, the old school as we might think of just for gout purposes.
Exactly.
Now we got to get into lipids next. So the words aren't getting any shorter, but tell us what we got around lipids, Jake.
Yeah, hyperlipidemia, high fat in the blood. So we can break this out into a couple of even bigger words: hypertriglyceridemia, hypercholesterolemia. Now we commonly associate these with cardiovascular disease, and they are key drivers of cardiovascular disease. But in and of themselves, they are metabolic conditions. Both triglycerides and cholesterol are lipids or fats produced in the liver and distributed through the body.
Now, as I recall correctly, the triglycerides are going to fit more into that fuel to energy conversion category, but cholesterol is going to be more around the building of structural components. Would you say that's accurate?
That's exactly right, yeah. The liver and fat tissue are circulating triglycerides to use as a fat source, as a fuel source, and then the liver is making cholesterol for other tissues in the body to incorporate, like in their cell walls and things like that.
Gotcha. So I would assume we're going for a lipid panel here, and what kind of things are you looking for on the lipid side, Jake?
Yeah, so we start with this kind of a standard lipid panel. So most patients are probably familiar with this. It's our blood cholesterol levels, including the LDL and HDL components of that, the triglyceride levels. I think where we go a step further is we include an apolipoprotein B, another big word, ApoB for short. This is a complex topic, been pretty popular in the podcast here recently, so some of you may have heard of it. We are going to do another talk on it, dive in a little further at a later date, but for now we'll say that it's important to include because it's a strong predictor of risk, stronger even than LDL or cholesterol levels for cardiovascular disease.
Yeah, I mean, that's a big deal right there, certainly when we look at the prevalence of cardiovascular disease, and something that I haven't really seen on a lot of lipid panels, at least personally, that I've had done over the years.
We're not seeing it commonly in practice in the U.S. yet, but it's an important metric. Let's go ahead and stay on the topic of fat, but kind of shift our lens from the micro to the macro and talk about visceral adiposity.
Yeah, visceral fat is really getting more into our realm back on the physiology side, and one that I'm really excited to be able to do assessment of because in the past we've been limited to just total body fat assessment. And I think what we realize, is from the research is that particularly this visceral fat, look at the downstream effects of it, and it's quite a bit more serious than just looking at total fat levels. So what is visceral fat? Well, I think we got to separate the subcutaneous fat, or the fat that's between our skin and a muscle. That type of fat is fat that we can measure through just an old school pinch test, or more recently the use of ultrasound or something similar, just to measure that surface level fat. But the visceral fat's a little harder to detect, and it hides out around the organs. And in particular, I think it's a lot more negatively impactful because of all the activity that it has going on. I mean, it's really a living organ within our body. So Jake, can you tell us a little more about what type of activity that visceral fat is bringing forward?
Absolutely. So it secretes all kinds of hormones and inflammatory markers called adipokines. It contributes to insulin resistance. It even has an enzyme called aromatase that converts testosterone to estrogens. And all in all, we care about this because these things all associate with metabolic and cardiovascular disease.
And we're really excited about one of the new tests that we have that can more directly assess for visceral fat, and that's the DEXA scan. So historically, we've been limited to really accurate measures of total body fat, but now through DEXA scanning, what we can do is we can actually get a breakout of that visceral fat with the stronger disease correlation. And in addition to that, we can also see bone mineral density, so getting that third compartment, so it's not just fat and lean. Now we actually have the bone piece along with the fat and the soft lean tissue. The printouts will show a segmental piece too, so there's a color man on the printouts, and you'll be able to see the segmental distribution of fat as well as skeletal muscle. So it's a really cool printout with some additional metrics on it. Now, I think when we talk about that visceral fat, there's a tie-in here specifically to our next topic and category, which is the dysfunction that can occur at our liver and how that impacts us metabolically. So Jake, tell us a little bit more about that.
Yeah, so the liver really is the ultimate multitasker, which makes assessing its function difficult. But we can break its roles out into a few different categories that allow us to get a pretty complete picture of it overall. So first we have synthesis. The liver kind of functions as a manufacturing center for the rest of the body. So we can check things like the albumin and total protein levels in the blood, get a sense in general of the liver's synthetic function. Next, we have its processing functions. It's recycling sort of used parts or transforming or repurposing what it can. And then any waste products that it's not able to reuse or repurpose, it prepares for disposal. And the two tests here that we're looking at are a couple enzymes called AST and ALT. And then the last function is the biliary function. This is primarily digestive function, but it also is an important part of the ridding of waste. And the tests we're looking for here are alkaline phosphatase, GGT, and bilirubin.
And what strikes me is just how interrelated this is and how important our liver function is for our overall metabolic health. And I think a lot of times that connection is not always made, out in the health and fitness world. So when you are looking at the liver, is there any one metric that stands a little bit above the others? I know there's a lot of different components here.
Yeah, they're all important, but I think talking about this in the context of these other metabolic dysfunctions that we're talking about, the one I'm most attuned to would be the ALT, and that's because it is most associated. High ALT levels are most associated with non-alcoholic fatty liver disease, which is now the second most common reason for liver transplantation in the U.S.
Yeah, incredible. Let's talk about next, what our metabolic function looks like in terms of on a full picture scale here. So the questions we're always getting is, hey, is my metabolism fast or is it slow? And the good news is we actually have tools to assess this at the end of the day. And I think it's important to jump in first and just look at what makes up our total energy expenditure in the day, because there's different parts or pieces to that. I always like to envision things as a pie chart, and look at the different components that make up that energy expenditure. And you'll see there's a number of 3 and 4 letter acronyms that make up our metabolism. The largest piece is that RMR, or the resting metabolic rate. Now, the resting metabolic rate, that's accounting for the calories that our body would need just to run its basic or basal functions. And that would be, practically speaking, if you lied in bed for 24 hours, the energy that it takes to, run your heart, to have your heart beat, your lungs to breathe, just to fuel those essential processes. Most folks, it's 50 to 70% of your total caloric burn. So something we don't have a lot of control over necessarily here in the short term, at least. Now, in addition to RMR, you're going to have calories burned through just general lifestyle. So walking, talking, movement. We know most people aren't lying in bed all day. So those calories are called NEAT, or non-exercise activity thermogenesis. We add in some additional calorie burn through the digestion of our food. This is called TEF, or thermic effect of food. And then if we exercise that day, we have our EAT calories, or our exercise activity thermogenesis, on top of that. So we have all these components that make up our total metabolic function. And when we come to assessment, we really focus on the resting metabolic rate. And obviously it's because it's the biggest part of our metabolic function. And so we can assess this through a test called indirect calorimetry, which is a fancy way of saying we measure oxygen consumption at rest. We're trying to figure out 2 things. Number 1, get a measured value of that RMR and figure out, is that value faster, slower, or about the same as we might predict, just using those good old generic formulas. And then also we're looking at substrate utilization. So is the individual using fat versus carbs at rest, and what's the predominant fuel source? We hope that's fat at rest, but there are some things that can impact or influence that. Now, looking at resting rate as a whole, there are some major influencers here. And I think the first three, are the general stuff, right? Genetics, age, and sex. Obviously, we don't have a whole lot of control over those things. But we can look at the last two, body mass and hormones, as things that we may have a little bit more control over. And specifically on the body mass side, we're talking about that skeletal muscle mass. The nice thing here is we got the DEXA scan we talked about earlier. That's basically a 2-for-1 here, because not only are we able to look at that visceral fat, but we're also able to assess skeletal muscle mass. And then on the hormone side, we talk about that thyroid throttle, which I'm going to throw that back over to you, Jake, and talk about your panel and what you're looking for on the thyroid side.
Yeah, absolutely. When we're talking about overall metabolic function, thyroid is king. It really does function as a throttle. It can slow down or speed up the metabolism as a whole. So the panel we're running to check on that is your TSH, your thyroid stimulating hormone, your T3, and your T4. Those three together give us a pretty complete picture of your thyroid function.
One of the things we're most excited about is the ability just to tie in the physiology testing with the DEXA, the RMR, back in with a lot of your blood panel and your work, underneath the hood, so to speak, and really put that together for people to give them a complete picture of their metabolic health. So if y'all have questions, don't hesitate. Shoot us an email, drop us a line. And if you want to get your metabolic health assessed, there's a link there at the end that'll take you right to our website to do so.